we turn to our medical expert, Dr. Kevin Campbell. You know, before we get to some things that can protect your child, what are some of the common things that you see that would cause something like that tragic situation to happen?
Fortunately, we only see about 100 sudden deaths in young athletes U.S.-wide during the year. And one of the most common things is something called hypertrophic cardiomyopathy. It's a situation where the heart muscle becomes very thick. It accounts for about 50% of cases of sudden death in athletes. And other things are other congenital abnormalities, such as some abnormal heart function and also abnormal blood supply to the heart, as well as some other genetic disorders that can play a role here.
So I have a 14-year-old daughter who plays high school basketball. What are some things that I can look for as a parent that I say, oh, well, maybe that's a warning sign?
One of the most important things you can do is talk to your child. If they have chest pain, shortness of breath, and one of the more important signals is if they pass out during exertion, then that's very, very concerning. If you have a history of premature death of young people in your family, I think that that's also something that you've got to talk to your pediatrician about.
So the first thing that really ran through my mind when we started talking about this story was, you know, you get that initial physical as an athlete, and then I thought, wow, if I can take it to the next step, maybe that's going to cost too much money. My insurance won't cover it. But you told me there is a really good and economical alternative, or a way that you can check your child.
So in Europe, every school athlete has to have a history, a physical exam, and an electrocardiogram to measure heart rhythm and look at the heart from a tracing from the chest. In the U.S., the American College of Cardiology recommends that we only do a history and physical exam. There's actually a study that came out last year that showed that if we do EKGs in addition to history and physical exam, we significantly increase the number of cases that we catch before something bad happens. We may see changes in the guidelines here in the U.S. in the coming years. If that EKG is abnormal, you may need something called an echocardiogram, which is an ultrasound of the heart muscle.
And the EKG, I want to make this point, it's what, about $50?
It's about $50, and it's something that you need to talk to your pediatrician about. If you have some of those high-risk features, then they're probably going to want to order that EKG.
For sure, and you know, no amount of money is worth
absolutely
the risk of
not.
health. Great information right there, very timely. Dr. Kevin Campbell with us. We always appreciate it. And if you have a question for Dr. Kevin Campbell, you can ask him. It's easy. Just log on to our website, hit up WNCN.com. Links that we mention is what you'll search. From there, you're going to find Dr. Campbell's website, or you can like his Facebook page or Twitter. He is very accessible. We'll throw it over to the Weather Center now.